Hello everybody, my name is Beth Ritter-Guth and I'm the Associate Dean of Virtual Services at Northampton Community College and a longtime adjunct here at DeSales in the English and Criminal Justice Departments. I am so excited to be with you and so thankful to your instructors for inviting me to talk about artificial intelligence, which is my passion. So tonight we're going to talk about artificial intelligence as it applies to healthcare, but I want to give you some best practices. I want to help you think about AI in the work that you're going to be doing in the field. Underpin that work with some safety measures, and then talk about some tools that you might be able to use to help you in the work that you do. If you have any questions, your instructors have invited me to speak to class, and I will see you soon, so please jot down any questions you have, and I will be very happy to answer them. So let's get started. We're going to talk about how to navigate the ethical landscape of AI in healthcare, but I'm not going to pretend that I know anything about healthcare because I certainly don't. You are the experts. Your instructors are the experts. But what I am an expert in is how AI works and how we should use it in fields that have private information. So if you remember nothing else that I tell you tonight, please remember this one thing. Never ever put private information about you or other people into AI unless you are sure that the AI tool that you're using has security built into it. And there are some tools that do that. There's Legal GBT for the law field. There's an equivalent in higher ed. There's an equivalent in the medical world. But make sure that we're never, ever, ever putting personal, private information into AI because that is very risky and very dangerous. So don't do that. All right, so let's talk about how AI works, because I think it's important to understand how it works, which will help frame how you think about it. So if you imagine for a minute, we're gonna go down a little trail here. All right, imagine that at St. Luke's Hospital, anytime anybody, a patient, a staff member, a visitor asks a question, every single time, somebody with a broom comes and sweeps the entire floor of the whole building and puts it in a pile. Now imagine if every time a person, patient, doctor, anybody asked a question, they swept the floor of every St. Luke's hospital or St. Luke's installation and put it in a pile. Then imagine if every time somebody asked a question, they swept the floor of every hospital in the world and put it in a pile. That is how AI works. Every time we ask a question of an AI tool, that tool takes its broom and it sweeps the whole internet and it puts it in a pile. Now, AI does not have the ability to think about the data that's in that pile. It doesn't have the ability to judge whether that's good information, right information, or wrong information. It just sweeps, puts it in a pile, and picks things based on what it thinks is the right answer. So, for example, if I asked a question like, how would I take a temperature, right? Enough hospitals in the world, enough doctors' offices, and enough websites have provided information about how to take a temperature, right? So it's going to look at all of the examples and say, well, these are all the same, so that must be the answer. Now, if you imagine all that sweeping, sometimes there's a tire, sometimes there's a toothbrush, there's like random stuff in there. Well, the AI doesn't know that that's not right and that shouldn't be there, so sometimes it'll pull wrong information or it'll make up information if it can't figure out what the right information is supposed to be. We call that hallucinating. So anytime that we use AI, we always want to be sure to verify that the information being produced is correct, and we want to make sure that it's complete. Because AI will do a great job in a general sense, but sometimes it doesn't have the ability to go deeper. And sometimes we don't know where it has trained its information from. Like, what websites did it get that from? Did it get it from like Bob's blood pressure and temperature website, or did that come from the Mayo Clinic, right? So in a lot of tools, we don't know what training grounds are being used. We don't know what hospitals are being swept. We don't know where the information is coming. Those tools, as I'll show you a little bit later, are changing, and we're starting to know where AI is getting their information. And those are the best tools, in my opinion, to use. So a lot of folks are like, I don't use AI. Well, let me tell you, we've all been using AI for years. If you have used the spell checker in Word, you've been using AI for quite a long time. So AI has been around, believe it or not, since the 1960s. Generative AI, the AI that we're talking about today, the ChatGPTs of the world, launched pretty recently to give the tools to everybody, but these tools have been around for quite a long time. So it's not new technology, it's just technology that's now in our hands, and we have to be the ambassadors of truth and make sure that we're using these tools ethically. So let's just talk a little bit about AI in healthcare. So AI can help power our workflow. It can help summarize data. It can help summarize research data about particular equipment or particular processes, or even, diseases or ways to get better, or wellness, or whatever. It can take all of the things that it sweeps every time you ask a question, and it can kind of find patterns in what is out there. And smart systems that are designed to be safe, are really, really great and exist. So not all AI is bad. It's just that we wouldn't want to put patient data into ChatGPT when we would rather use a tool that is designed for hospitals and has security measures built into it. So we always have to be sure, no matter what we're doing, that we are honest and open and authentic about our use of AI. So for example, this slide deck was made with a product called Gamma, which I'll be sharing with you in a little bit. Gamma is an AI tool. And so I tell people all of the time, I'm using AI, I've used AI, I took my notes, and now I'm old-fashioned, because I've been around a long time. I often write on paper. And then I'll type my notes. I use a Mac. I type my notes into the little notepad in Mac. And then I will take my notes and I'll put them into an AI tool, and it'll make something like this from my notes. So whatever workflow you use is fine, but you want to always be honest that you've used AI. And I think in our culture we have, especially those of us from my generation and my colleagues of my generation, we were always taught that if it isn't your work, it's not real work. Or if it's not your work, it's dishonest because it's somebody else's work. AI work is not somebody else's work, right? AI creates something new each and every time it sweeps the floor. So you're not plagiarizing somebody else's work. It isn't somebody else's work that you're copying. It is creating a new document, presentation, song, video, image every time it's sweeping the floor. So it is new content. Now, there are lots of debates about whether you should do that, or whether that's art, or whether that's ethical, right? There's all kinds of debates about it, but the simple fact is that you can use it to do a lot of things more efficiently. Will that replace jobs? It will change jobs, right? There will still be human jobs, because if you think about it, every time I call St. Luke's, I live in Palmerton, every time I call St. Luke's, I talk to a robot. I hate it. I sit there on the phone saying, please, human, 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 right? Because we do want to be connected to other humans, right? We do have a need for that human connection. And what AI can do is it can do all the research and the boring, repetitive tasks that we do every day. It can do those automatically for us so that we can spend more time connecting with other humans. So when we use AI, we want to be sure to be authentic about the fact that we're using it, and we want to provide informed consent. So if you are working with the AI tools that are built for healthcare, we want to be very clear with our patients, with our clients, with our doctors, that we are using AI and that we will be using this tool to do this task to get this result. So we always want to be very clear that we're using it, how we're using it, and what will happen with the data as it's being stored, or if it's being erased or whatever. So, and then in the end, excuse me, we want to respect the patient's choice. If the patient says, I don't want my information put into AI, we have to respect that. The same in education. I don't actually put student data into any tools. But if a student in my class, if we have an assignment that a student, that we're using AI and a student says, I don't want to use AI, I have an alternate assignment for them that doesn't use AI. So we want to respect people's ability to choose to use or not use AI. So we talked about this. We want to be transparent. We want to model that transparency. We want to document how it is we're using it, what it is we found, how that information is being stored, how it's being disseminated and shared, how it's being assessed, and any next steps that are going to go on. And we want to make sure that we're telling this to everybody, all of our stakeholders, our teachers, our patients, our reps, our drug reps, whatever. We want to tell everybody, like, we don't want to be shy. We don't want to be embarrassed. It's not, this is a tool. These are tools that exist, and we are using them ethically, and we want to model that ethical platform that we're using. We want to share that, because then that'll encourage other people to do it the same way. And we want to be accountable for what we do, right? And so if we're very careful about how we're tracking, we're being authentic, and we're being transparent, that will help us to be accountable in how we collect and share information. We want to make sure that we're looking at bias. So AI is getting better at this, but if I would do a search in ChatGPT and say, give me a case study about a doctor and a patient that needs care after they leave the hospital, right? Almost always, the doctor is going to be a white, middle-aged male. The nurse is going to be female and young, and the patient is going to be an elderly woman. Now, the bias is getting better, right? But remember that AI doesn't have the ability to reflect or to think about the data it collects. It's not sentient. It doesn't have thoughts. It's collecting what's out there. So what's out there on the floor are white, middle-aged male doctors, young female nurses, elderly patients, right? That's what it finds. So they're working with the tools to make sure that there's more representation, so that you might have a young female doctor that's maybe Indian, right? Or a young male patient who might be Native American, right? So the models are working on trying to get diversity, more standard, but we're not quite there yet. So when you're looking at your output for AI, you want to always look for bias. You want to look for holes in representation. What isn't there? So AI can look through the pile to pull, but sometimes it doesn't know, it doesn't exactly know what it's pulling. So sometimes you have to help it. So AI should never be used without review and without editing. You are in control, and that's why humans will always be necessary, because it just sweeps and pulls. Your job is to look at what it pulled, add to it, make sure that it's ethical, make sure that it's complete, and make sure that it doesn't have bias in it. We always want to pay attention to security. So in every hospital, they have an AI policy. At higher education, we're working on it, right? Know what the policies are for privacy at your institution or at your hospital or in your field. Always know what the policies are. If you ever have a question, reach out to your IT department and ask. I want to do this. Can I use this tool? IT people, I work in the IT department at Northampton. They tend to be much more cautious than most, so they will tell you all of the risks. They will know all of the risks. And really the bottom line is what personal data is going into there. So here's a good example. Let's say you want to spruce up your resume. You get your degree from DeSales and you want to go get a job, right? You're going to put your resume into an AI tool and it's going to spruce it up. Take your name off. Take the names of the hospital off. Put in a fake name. Put in a fake hospital name, right? That's all you have to do to change it. It'll still look at your thing and spruce it up for you. Just don't put your name in it. Don't put your employers in there. Don't put real phone numbers in there. Make all that up and then let it, jazz up the other text and give it back to you, and then you can replace and put your name and your real details. So that's a way to do that. Never ever put patient files or patient notes into AI unless you're using a closed system that has been purchased by the hospital or institution you're working for, right? And they will provide the training, they will provide the guardrails that are required to use that tool. Because at the end of the day, the hospital is liable for the information, but so are you. As a professional, you are liable for the information that you put out there. So there's your responsibility, the developer's responsible, right? So the tools that the hospital picks when they do their negotiation to purchase that tool, they have an agreement about privacy and leaks and things like that. And then there's somebody at the institution, at the hospital, overseeing that particular technology. So never use tools that are not approved by your institution, right? So at Northampton, my job is to approve tools. I look at them, I look at their terms of service, I look at how they're using the data, I look at where they're getting the data, I look at what they're doing with the data that we put into it, where is that being published, and what happens, which tools actually do a good job and which tools don't do a good job. We often think, well, I'm just going to put this in a ChatGPT. That's great if it's your stuff, but if it's hospital stuff, be careful because they might have a rule against that. All right, so I'm going to leave this slide for you to look through, but these are regulatory frameworks that are expected, that have been published and are expected. The last one, the EU AI Act, that's international because sometimes our hospitals work with other hospitals. But there are different frameworks that exist for the use of AI, the most important one being the NIST AI framework that is currently, it's established to manage the risks of data in healthcare and higher education, and education altogether. But really, at the end of the day, the thing that is most needed is human oversight. You are in control of AI. AI can only operate with you behind a keyboard, so you are the person who is going to ask the prompt, call that prompt engineering. The better the question, the better the response back to you. So be sure to be very detailed in your questions without using personal information. So I have a patient who presents with X, Y, and Z, and I've had 15 patients that present with X, Y, and Z, and I would like a management plan for each one of them based on their age. Here are their ages. I've not mentioned their names. I've not mentioned where they live, right? I haven't given their addresses. I haven't given their next of kin, whatever, right? You can ask really specific questions without providing personal information. So prompt engineering is an art form in and of itself. Asking better and better questions gets you better and better results. This is just some data for you on technical validation of AI results based on different questions that have been asked. We work together with a lot of different partners, so AI developers work with healthcare providers and patient advocates work together, people who just focus on ethics, and of course we always work with our legal teams, especially those that have to cover the insurance of our universities or our hospitals. We don't actually, the cyber law field is emerging, so we have a lot of gray areas right now with all of AI, but patient security and privacy, those laws exist no matter what tool you use. So whether you're using AI or not, we have laws in place to protect privacy. So the tool doesn't matter, but the law does. So you must follow whatever policies exist. So we want to build trust, and we do that by being transparent, by following the rules, by being part of the conversations that our institutions and our facilities have. We want to protect data at all costs, and we always want to involve our patients. We want to make sure that they have a choice in how their data is being used, and if we can help it. And then talk about some ethical, some economic and professional implications and how the workforce is going to transform. AI, a lot of people are afraid that AI is going to replace jobs. I promise you it will change jobs, but we will always need humans. You will always need a nurse to comfort you. You will always need a doctor to write a prescription. There will always be jobs in healthcare as in higher education. Our work will change, but that has been true forever. As the pencil, turned into the pen, turned into the computer, our work gets different, but the work doesn't go away. We always have work to do. And then when we look toward the future, this is a very dark slide. We just need to make sure that we focus on advocacy, making sure that the outputs are accurate, and that we have gone through and discerned the information to make sure that it is correct, accurate, ethical, timely, and we have the ability to continue to assess the information and outputs to continue making those things better. So, in healthcare, we are all responsible for the human-AI partnership. We are the ones who ask the questions. We are the ones who have to vet the results. That is our job. It is a shared responsibility. We have to follow whatever rules exist. We have to be careful about the tools we use. We have to be honest and open about our use of the tools. But at the end of the day, our main focus in higher education is on the student. In healthcare, it is the patient. Your job is to make sure that you're protecting that patient and bringing them into the conversation so that they can make the best decisions for themselves. So on that note, I want to show you some tools that I have pulled together for you. So this Padlet, your instructors will give you the link to it, and I have pulled together some resources for you to read and things for your instructors to share if they like them. And then I've included some tools that I use in my work every day. If I want to do research, I do research all the time, mostly right now on AI, but I teach poetry, I teach American Romantics, I'm a classicist by trade, so I teach the classics. And so if I want to do my own research, I use a tool called Google Notebook. And what Google Notebook does is it allows you to bring in all of your research into a notebook. So if I want to create a new notebook, I'm going to create a new notebook. Right now I'm doing a project on Deal Island, which is in the Tangier Sound off the coast of Maryland. I can create a notebook all about Deal Island. I can put a document in there or slides. I can put a website or a YouTube link, or I can just copy and paste text in that I found somewhere. I can put up to 50 things in my Google Notebook, which is awesome. It's awesome, right? I can put 50 things in here. And some things are protected, and a lot of times hospital stuff is, if I can't use it, it will appear as a red link, and I'll show you that in just a second. I'm going to show you a completed workbook so that you can see. But you could have up to 50 sources. What I do is I make each topic its own notebook. So in Deal Island, I could talk about a million different things. Piracy is one of them. Global warming is another one. So each of those topics gets its own notebook, and then you can mash them together and pull things together from each notebook to make a super notebook, which if I had time to train you how to do that, I would, but I don't. So let me show you instead a completed notebook so you can see. So this is about using AI in the library, and you can see all my sources are over here. If a source is something that I can't use, the link will be red. I can change the title, and now I can ask questions, and I can say, like, how many libraries use AI? I can spell things wrong. I'm a horrible typist. And it will give me all kinds of information. And these links here, you can see where it got its information. So remember back when I said that AI is getting better about telling us where it got the information from their sweep? Google Notebook is telling us, this is of these articles that you provided, here are the places where it got the information. I like this tool because it allows me to do my own research. Now, a similar tool, which is very good, and I've just started using, is Deep Research by Google, and ChatGPT has the same one. I use Google. Some people love ChatGPT. Oftentimes, I will run a query, a prompt, through Gemini, through ChatGPT, through Claude, and through Perplexity. Those are like the big four. You can also use Copilot if you have access to that. There are millions of tools now for AI. So they're like car brands. You fall in love with the one you like. I'm a Jeep person in real life. You might be a Subaru person, right? So you just use the car that you like. But I often use a few different ones to see what kind of responses I get, and then I'll copy one response from one, paste it to another and tell them to improve it. I do all kinds of what we call mashups to see what it comes up with. But deep research by Google, if you go into your Google, let's see if I believe I have one here already made. I do. You can see that I made a paper for you, and I actually have this example up for you to look at. And what it does is it looks through all the research, and it gives you a report at the end. And this actually takes quite a while to cook. AI works pretty quickly, but what I love about it is that it tells you all of the sources that it used in the report. And then it'll tell you all the sources that it looked at but didn't use in the report. So works cited as opposed to a bibliography, right? It'll tell you, and it'll discuss what it used and why it used it. And these are all links that go directly to the sites that it got the information from. So whereas Google Notebook, you're doing the research and you're putting it in your notebook, Deep Research does the research for you. And you can see the outputs of these two in my examples. So you can see this was a deep research with Gemini. And then what I did is I took that research that Gemini produced,